Here in Canada, we are rightly proud of how open we are to both people and ideas from around the world. The one exception? Medicare. Hello, I'm Brian Lee Crowley, Managing Director of the Macdonald-Laurier Institute, and today I'd like to talk to you about how healthcare can be done differently. In this video series, we've been making the case for reform of an aging Canadian Medicare system that costs more than most other developed nations, and yet was recently ranked 10th out of 11 major national health systems based on fairness, effectiveness, and efficiency. Fortunately, as we're about to see, there are plenty of great examples, some in unexpected places, of good ideas for health system reform. We begin surprisingly close to home, in the very cradle of Canadian Medicare. And what we find might begin to shake the stubborn notion that any attempt at reforming Canada's centrally planned system would be a betrayal of Tommy Douglas's vision. Ask Janice McKinnon, who served as finance minister in an NDP government in Saskatchewan.
If Tommy Douglas were alive today, he wouldn't still be clinging to a 1960s system. He'd be saying, well, we're in a different era now, so let's look for better models out there.
In a paper written for MLI, McKinnon points to the use of private clinics in Saskatchewan as a successful innovation that defied the critics. Public sector unions, for example, opposed those private clinics, claiming they would cherry-pick healthier patients, would siphon revenue for corporate profits, and that using them would contravene the Canada Health Act. Nonsense. Patients were referred, not cherry-picked by clinics. The Canada Health Act specifies only that the system has to be publicly administered, and as for cost, the results speak for themselves. We compared dozens of different procedures in hospitals and in private clinics. In all cases, the clinics were less expensive, and in some cases, the savings were dramatic. Overall, it was 26% less expensive to use the clinics. Now that's a meaningful reform.
I would say a lot of people in Saskatchewan who really would have wondered about private clinics have been to them now, and they kind of say, I'm not sure what I see the issue is here. It's good service, it's easier, it's cheaper, why aren't we doing this?
The world is full of examples of better healthcare policy for Canada if we take the time to look. Now let's travel to Sweden, a nation famous for its state-provided social programs, to see how their system compares to Canada's centrally planned model. It turns out that while few in Canada have been paying attention, the Swedes have modernized their social programs dramatically, including healthcare delivery.
I think what happened was it started out as one of the welfare reforms that came in the early 20th century, and it grew into becoming an almost, well, call it socialist, planned economy structure where the public sector was both financing, producing, organizing, and doing the whole kit. But it was quite obvious even in the late 80s and early 90s that this had to shift because it wasn't delivering what people was expecting it to deliver. And the answer has been over time to introduce within this publicly funded system a larger portion of private actors, private suppliers of these services.
Both Sweden and Switzerland, to name another example, rely on private competition and cost sharing with patients to a greater extent than Canada. And yet reform compromised neither the universality nor the high quality that so many opponents of healthcare reform in Canada suggest would be the inevitable result. Sweden and Switzerland pay their hospitals in such a way that the more care they deliver and the more procedures they do, the more money they make. Unlike Canada, where hospital care is predominantly funded through block payments. This means that for a Canadian hospital, your care represents an expense. Sweden's new model has been associated with a 13% cost saving and noticeable improvements in efficiency without a reduction in quality or access to care. In addition, both Sweden and Switzerland employ privately owned providers for the delivery of hospital care. As a result, both countries are able to produce a higher volume and quality of services than Canada for the same financial outlay. In Sweden, the nation's only private acute care hospital, St. Göran, is historically the most efficient hospital in Stockholm. Combine private provision with a funding model based on services provided, and you're really onto something, because suddenly patients have the ability to reward the providers who meet their needs and penalize those who don't. Now let's look even farther afield, to Asia, where 3 countries studied by MLI, Japan, Taiwan, and Korea, have all demonstrated a willingness to reform and to innovate that would put Canadians to shame.
I think developed East Asian countries performs just as well, if not better, than Canada. Just give you a couple of examples. In terms of regular metrics such as length, wait time for elective surgery, for the number of physicians per 1,000 population, all these 3 developed East Asian countries, that the data is more or less same as Canada. Where it is much better in terms of the delivery outcomes is in area of long-term care services.
All 3 countries provide universal access while spending less, despite having to deal with populations that are aging more rapidly than Canada's.
One thing that could change in Canada is what's covered by our public health care system. We're quite comfortable, it seems, to not have dental care or drugs outside the hospital covered by public health care. To me, it would make more sense to be like Korea, Taiwan, and Japan, where they include dental care and drugs in their public health care system. However, they charge a co-payment. So a broader range of services and medical products that are covered with the co-payment, to me, makes more sense.
You'll notice that we haven't yet mentioned our old friend and ally, the United States, despite the fact that many Canadians continue to believe that there are only 2 ways to deliver health care: our way and the American way. Canada's system is almost totally government-controlled. The U.S. relies on market forces more than any other country. Neither has hit the sweet spot. Most of the better performing systems in the world are somewhere in the middle. We would do well to learn from their example. In our next video, we will paint a picture of a healthcare system that maintains the vital principles of Medicare, but in a more economical manner that focuses less on the needs of healthcare administrators and more on the needs of the person who should always be at the center of any discussion of healthcare policy, the patient. Thanks for listening.